Hi there, friends. So happy you're here with us for another informative journey through the pages of Jamaica Magazine. I'm your host, Adrian Atkinson. Today's all about public health development programs and getting more answers to your COVID-19 and vaccine-related questions. We also see some of the latest interventions to create a world-class childcare sector and explore the environment with protection as the mission. Sit back and relax with these and other interesting features right after these important messages.
It's absolutely critical that we receive the vaccines. You will see hospitalizations and indeed deaths likely come down. And so there is a lot of value to be gained by getting as many vulnerables on board as possible. So tell your mothers, tell your aunts, listen out for yourselves if you're over 60, and take the vax, because the vax is what will help you to guard against the COVID virus and indeed help your relatives, your friends, those who you come in contact with for the same benefit.
The Ministry of Health and Wellness is moving forward in the 2021-2022 fiscal year with the renewal and rebuilding of public health as its mission. Take a look at what's in store on the quest to achieve universal access to quality health care.
The Ministry of Health and Wellness is focused on realizing the vision for public health development this fiscal year and onwards. The Public Health Crisis Management Plan, which provided the framework for successful governance of the COVID-19 pandemic, will be strengthened in the event of future occurrence. Measures implemented have been successful in achieving lower COVID-19 spread than initially predicted, and the work continues to get 65% of the Jamaican population vaccinated by March 2022. Work continues this year under the 10-year strategic plan for the renewal and rebuilding of public health in keeping with Vision 2030.
The government committed a significant capital expenditure of between $205 million US and $236 million US over a 5-year period for infrastructure, hospital and health center build-out. 11 of 13 facilities have been designed and are being reviewed now for final approval to move to the next stage for building out.
Maypen, Spanish Town and St. Anne's Bay hospitals, along with the University Hospital of the West Indies, are included on the list for upgrading.
New services are going to be added to the Spanish Town Hospital, including urology, oncology, cardiology, gastroenterology, ophthalmology, and psychiatry.
Design for the St. Anne's Bay Hospital upgrading is to be unveiled in short order.
The new upgrade will include physical and functional reorganization of services, a new outpatient block, expansion of radiology, and a new intensive care unit.
The University Hospital of the West Indies will get a new 6-story, 120,000 square feet medical facility.
The University Hospital, which is our primary tertiary level hospital for teaching and research, serving not just Jamaica but the Caribbean, is going to have a new look in the years to come to benefit the people of Jamaica and the Caribbean.
Work also continues on the rehabilitation of the Cornwall Regional Hospital and construction of the Western Children and Adolescent Hospital in Montego Bay.
We are now entering phase 2B of the project, which will include demolition and structural repairs to floors 1 to 6 and installation of roof on floors 3 to 6. We're also now making preparations, Madam Speaker, to go to the international market for a contractor for the third and final phase to totally rehabilitate and equip all 10 floors of the Cornwall Regional Hospital. We're building out this infrastructure, and these are only but a few. A significant number of infrastructure that are slated under the IDB project. The Greater Portmore Health Centre, St. Jago Health Centre, Old Harbour Health Centre, Maypen, West and East, Brownstown Health Centre, St. Anne's Bay Health Centre, Ocho Rios Health Centre. Madam Speaker, the resources are in place. The Designs are almost complete, and in the next year, or certainly during this period, you will see us breaking ground for the renewal of our infrastructure.
Also on the agenda this fiscal year is an $8.5 million investment in a digital integrated health information system. The installation of cloud network computer hardware will start at 3 hospitals and 9 to 12 health centers.
You go to the doctor at a hospital, you came from a clinic, the doctor uploads your information, you don't have to wait 2 hours to go find the paper-based file. It will have your medical history, which medication you are taking, what were your symptoms, how are you being treated, what are you allergic to, if you have x-rays, what those x-rays showed, and the doctor will be able to prescribe, having assessed you in a much more efficient way.
The ministry is also identifying a vendor to gradually roll out home care and telemedicine.
COVID-19 has not only taught us that we cannot take our health for granted, but also how important health financing is to building, sustaining a resilient health ecosystem. It is time we discussed and agreed on how to secure health financing in a sustainable way.
The Health Ministry is also advancing preventative health care, targeting the epidemic of non-communicable or lifestyle diseases.
It is with this in mind, Madam Speaker, that the government is moving to establish baseline information on ingredients in processed foods and will seek to use this information to provide greater consumer awareness. We have commissioned studies on salts, sugars, and trans fats in our foods.
A Better For You menu option is also being rolled out in conjunction with a number of restaurant chains to promote healthy eating. A pilot software application called JA Moves on the Move is also being launched to promote self-monitoring of personal health status. The app will allow individuals to check their blood pressure, blood glucose, weight and stomach mass, and input that data on their phones. The comprehensive tobacco control legislation is also being finalized as a joint select committee of Parliament continues to examine the bill before it's passed into law. All this forms just some of the wide range of transformational work within the Ministry of Health and Wellness for the 2021-2022 fiscal year and beyond.
Jamaica's COVID-19 vaccination plan is still in effect. If you wish to make an appointment, please do so online by visiting moh.gov.jm or by calling 888-663-5683. Vaccination still a keep. Go get your jab today.
The novel coronavirus poses a real threat to people's lives, and the experts have concluded that vaccination is critical if we are to prevent serious illness and deaths. Experts in the field of virology and public health are keen to explain this as they provide answers to COVID-19 and vaccine-related questions. Keep watching to learn more.
After you get your first dose, it takes a few weeks, about 3 or 4 weeks, before your body has produced sufficient protection to reduce your risk of COVID. So if you get exposed in the week or the second week after your first dose, you could still get COVID. But once you've had 3 to 4 weeks after the first dose, the risk of getting COVID is much, much less. After you get the second dose, 7 days after the second dose, you are fully protected. And therefore, it is rare to get COVID after you have 2 doses. We already know it lasts several months, but we don't know how long it will last. For instance, the flu vaccine often lasts only a year. You have to then get another flu vaccine the following year. We're hoping that the COVID vaccine will last longer than that. Maybe you will need a booster in a year or 2 years or 3 years. That is still to be determined, but we do know that the vaccine is good, so we are optimistic that it will give you protection for a good while. If someone is sick with COVID currently, then we do not advise them to take the vaccine while they're ill. After they recover, they are going to develop immunity and protection to getting infected again. So usually we say wait 4 to 6 months, since we know that people will have immunity for at least 6 months. So we say allow someone else, since there's such a problem with the number of doses available, allow someone else to get vaccinated and they could wait 4 to 6 months. But if they have recovered and they do take the vaccine, no harm will come to them. In fact, that will act as a booster to their immune system, so they'll be even more protected than before. Someone with lupus should get the vaccine because that's someone with a comorbidity. If they get COVID, they're at risk of having more serious attack of COVID. So as long as they're not having an acute flare-up, then they should get the vaccine. If they're having an acute flare-up of their lupus, as soon as it is controlled, is reasonably controlled, they should get the vaccine.
You have a comorbidity, then therefore you are definitely on our priority listing. So I want to encourage you to continue to build your immune system, eat right, certainly get some sun in the day, a lot of sleep, so that when it's your turn, your system will be ready to accept the vaccine.
Thank you.
It is a conversation to be had with your physician as to your current robust status. So if you are well, you are not having a flare at this time, then yes, you ought to take the vaccine.
Hurricanes can strike at any time. In the event of one, be prepared to act quickly. If a hurricane watch or warning has been issued, review your home disaster response plan. Map out likely routes to evacuate if your home is at risk, and confirm with relatives or friends you plan to stay with. Also, confirm the location of the nearest shelter. Check your emergency supplies and restock if necessary. Remember, disasters do happen, so be prepared.
We might not have given much thought about how the environment helps to keep us healthy, but that does not stop it from being true, nor does it take away our responsibility to preserve ecological balance in nature. That includes planting back trees where they are cut down to make way for development. Here's an example of a state entity embracing the responsibility to maintain environmental balance. The island's 3 million trees in 3 years initiative is getting even more support, this time from the National Road Operating and Constructing Company, which recently staged a tree planting exercise in Manchester. Get the highlights next.
Do what you can, where you can, to restore our ecosystems and preserve our environment. We owe it to ourselves as Jamaicans and to ourselves as global citizens.
The National Road Operating and Constructing Company, NROC, has responded to that call, planting trees across Jamaica. And just recently, those activities took NROC to Hope Village in Manchester. NROC's 30,000 Trees in 4 Years initiative began in January 2021. Since then, the program has been gaining support from communities in which NROC operates. As the government entity responsible for the establishment, development, financing, operation and maintenance of tolled highways, NROC has bases across the island. That includes Highway 2000, where extension work is currently being done on the east-west leg between Maypen in Clarendon and Williamsfield in Manchester.
When you do a highway, you remove fruit trees from farms, and between Milk River and Williamsfield, we would have gone to a number of farms, remove cash crops and some fruit trees. So we thought that it would be good to give back to the farmers fruit trees to replace what we take out. And where we have open plots like this one, we would now put a program in place to do a blitz, as we call it, to plant trees.
The latest location chosen is the Hope Village community, which is adjacent to the Melrose Bypass Road. Home to an inactive fruit orchard, Hope Village was the ideal partner for the tree planting exercise. 400 assorted fruit trees, including ackee, apple, June plum, sweet tamarind and guava, were used to replenish the orchard.
As an association, we are extremely grateful because we believe not only music is the staff of life, but food also is the staff of life. And we are so very happy that they were able to partner with us and to take this fruit trees planting a step further than the few we had.
So it's a partnership and we're doing very well in terms of a community space, and the highway will impact this community very closely because it's close by.
Members of the Highway 2000 family also chipped in, including Stanley Consultants Limited, China Harbour Engineering Company, and Jamaica Infrastructure Operators.
So the Prime Minister, your card, had given us a charge to plant 3 million trees over the next 3 years. And so this is our part. Today, the people that have come with us, the team today, will plant about 6 trees per person. So we're well on the way.
The Rotaract Club of the University of the West Indies Mona campus also joined in on the tree planting exercise. This is their second such involvement, and by all indications, the partnership will continue.
Environmental awareness, environmental advocacy is one of the major areas of focus for Rotary International. For us, participating in an event like this is just natural.
Environmental stewardship is one of the big things internally for us, where we seek to maintain environmental balance. So as we try to incorporate a new environmental standard into our overall standards, we're ISO 9001 company, and we're going to incorporate this year ISO 14001, which looks at environmental management. So that is part of it. This is part of that exercise to support how NROC operates as stewards of the environment.
We should all want our children to grow and feel secure and safe, but the truth is there are children who continue to face harm and abuse from persons who should be protecting them. The Child Protection and Family Services Agency is working to end this by encouraging reporting and redress. Keep watching to learn more.
It's no secret. Child abuse remains a stain that many perceive as irremovable because of its prominence, silence from witnesses, and its broad global impact. But agencies like the Child Protection and Family Services Agency, CPFSA, are working twice as hard to remove that notion. The agency's latest effort, a child abuse community drive-through to sensitize citizens and awaken voices and actions to end even the smallest idea of abuse towards any child.
A message that says to the citizens all over Jamaica that it needs all hands on deck to care for our children.
The Child Protection and Family Services Agency has a mandate for children who are deemed to be in need of care and protection. These are children who have been abused, abandoned, neglected or otherwise at risk. And we do interventions based on the several programs that we have.
Through its child abuse community drive-through, the CPFSA has engaged members of several communities in St. Anne. The message was delivered through public speaking, flyer distribution, and other engaging activities.
If you feel like a child is being hurt, you have to report. We don't want you to get the facts. We don't want you to investigate. We don't want you to come with evidence. We want you to tell us so that we can roll out and do what we have to do. And so that's why we're trying to say to the persons in St. Anne today, you have to report.
The engagement is garnering partnerships with power movers of our nation. The initiative has been welcomed and joined by members of the Center for the Investigation of Sexual Offences and Child Abuse, CISOCA, the Jamaica Constabulary Force, JCF, and the Ministry of Justice, among others.
Our service partners are on board. They have come out to support us, and that is the message we want to send. So we have persons from the police, the CISOCA department, persons from restorative justice, from the child guidance clinic, from the probation department, from the hospital. And so it is saying to the wider society, look at how we as service partners have to collaborate, because caring for a child has so many dimensions.
Every year we partner with the CPFSA on different initiatives, whether it is parenting program or directly having to do with children.
It's things like these that our department, Community Safety and Security, is very interested in partnering with.
Of course, solving the issue of child abuse goes far beyond what these agencies are doing. Accountability continues to rest on the shoulders of a much larger Jamaica.
And I want to also speak to the prescribed persons, the persons who by virtue of their employment have to treat the children. So all the guidance counselors, the teachers, the doctors, the dentists, the librarians, you are prescribed persons. Meaning by law you don't have a choice. It's not that you wonder, should I or should I not? The normal man may wonder, but we as prescribed persons, we must. And if we fail to do so, we are failing our children.
Children want something that they can look up to and aspire to be. And when they see that there's so many persons behind them willing to assist them with getting all that they need, then it is a good look for our children. And I just want to encourage you parents to know where your children are at all times. It doesn't matter if you're going to leave them with a friend or anybody, just know where they are. Keep checking on them. Build a communication, break that gap so that you're able to reach them whenever they are having a situation.
And even if you're not a parent, guidance counselor, a teacher or doctor, there's still a part for you to play in ending the plague of child abuse in our country. Volunteer at a child abuse prevention program. The CPFSA's initiative is a great start. Understand what child abuse is and know the signs. Unexplained injuries are not the only signs of abuse. Look out for signs of depression, fear of adults, or even inappropriate sexual behaviors. Teach children their rights. Help them to understand that they have the right to be safe. That way, they'll be more likely to report an offender and less likely to think that the abuse was their fault. And report suspected cases of abuse or neglect.
You do not have to leave your name. You do not have to leave your information unless you choose to. You will remain anonymous, but what it will do, it will give even one child a chance. Children who are hearing, you can also self-report. If it is that you begin to feel uncomfortable with any adult, there is a way that you can call and you can self-report.
So, the mission is clear. Working together to end child abuse in our island home.
Break the silence, report child abuse. That's the only way we can help our children. We have one aim and one aim only, to protect the Jamaican child.
This is where we end another wonderful journey through the pages of Jamaica Magazine. We value your company, so be sure to join us again tomorrow for another show. Until then, continue to watch these and other programs by logging on to our website, gis.gov.jm, or subscribing to our YouTube channel. You can also find us on all the major social media platforms and through our mobile app that's Android and iOS compatible. On behalf of the entire production team, I'm Adrian Atkinson reminding you to follow the COVID-19 protocols and do stay safe.
This has been a production of the Jamaica Information Service, the voice of Jamaica.